I am Dr. Sunny Gugale. I am an orthopedic surgeon, sports medicine specialist, and a robotic joint replacement surgeon. I am practicing here since last 15 years. My Happy Joints clinic is in Pune Swargate area. Today I am going to tell you an interesting story of an young 32 years old adult male having a knee injury in the past. This gentleman had a knee injury, a twisting injury during playing almost a year back, and he had an episode of sudden knee swelling and a sudden knee pain, for which he took a lot of local treatment. He took rest, he did a lot of icing, he did some massage therapy, and that is how this knee pain subsided, after which he could stand and walk. So he thought that it was a minor injury and he neglected it, and he started walking and doing a lot of activities in later on. He even started to play weekend sports, which he was not mentally and physically prepared for, but because of peer pressure he started involving into active sports in the weekends. Initially he was hesitant to do these sports activities, but gradually he started doing a little bit of exercises. He got a good strength. He met one of his friends who had a similar injury in the past, and they had a discussion that you start doing exercises, the knee will become better, and that is how he took care of his problem then. This was almost 2 months after his injury, and his knee function returned to normal. He could walk very well, he could stand, do a lot of activities, but he had a small symptom that he was not confident about his knee joint, and whenever there was an activity which involved a lot of physical exertion of the knee, he did not use that knee joint very well. Later on, after few months of going through this all, after like 5 months after the injury, he started playing regularly, and he used to get episodes of jerk and twist and turning around the knee joint, which led to some certain sense of wobbliness around the knee joint, but he used to ignore it, saying that there would be some issue and which will take care of its own after a certain period of time. Gradually later on, he had 2-3 episodes of twisting injury, which made him actually fall down and buckle, but again that was associated with a small episode of knee pain and discomfort, and that is how the knee pain subsided later on. This gentleman now, after almost a year after his knee injury, came to me in my OPD with a sudden onset of knee pain and a locked knee, which means that he could not even bend his knee or he could not even straighten it out. After thoroughly examining his knee joint and looking at his x-rays, then I asked him a simple question: is this the first episode of your knee problem, or you had such episodes in the past? Remotely remembering, he thought that there was an injury sometime back and which healed on its own, and I did not take care. I ignored it that point of time, and I did well later on. Then after detailed inquiring about his symptoms, he told me that he had repeated episodes of instability. This is known as ACL insufficiency, or this is known as instability because of his ligament injury in the past. Then he had repeated episodes. After doing a detailed examination, after doing an MRI of his knee joint, I found out that currently he had two ligaments which were injured, the ACL and the MCL. He had a meniscus which was torn and which was locked in his knee joint, and he also had a cartilage injury in his knee joint. Now at this point of time, this gentleman tells me that he wants to do a knee treatment and he wants to become completely alright. Tell me friends, how is it possible? If you have ignored your knee problem then, how can you do a surgery, miraculous surgery now, and give him a normal knee joint which was already being in an abnormal situation for almost a year and undergoing through a lot of multiple injuries in the past? So friends, here I want to point an important message. If you have a knee injury in the past, do not ignore it. Come forward, meet your doctor. Every knee injury doesn't end up with a knee surgery. So there is nothing to be scared of. On detailed discussion with this friend, I found out that he was worried that if he goes to a doctor, there is going to be some surgery advice for his knee joint, which is going to cause his knee to get completely damaged. Friends, we as a doctors are here to help you out and not to put you into trouble. So if you have any knee problems in the past, do not ignore it. Please come forward, get yourself treated there and there itself, because at certain times there will be some small injuries which can be managed well during that period of time, or there can be a major injury which can be treated surgically there and there itself to avoid repeated injuries in the future. We did surgery for this patient, we did his ligament reconstruction, we also repaired his MCL ligament, we also repaired his cushion. But now this knee is going to come to a good function, but is not going to restore its normal function which was there when he had a normal knee joint, because the knee cartilage, the cartilage coating on the knee bones is showing signs of wear and tear because it was exposed to repeated stress and strain during a period of 1 year after his index surgery. So These type of injuries should not be ignored, and you should get them treated there and there itself to avoid two things. One is to have a repeated injuries in future will lead to other subsequent ligament injuries or meniscus or cartilage injuries, and second, most importantly, that ligament injury, if not treated, then will lead to repeated instability and lead to arthritis in your knee joint. Hence, friends, do not ignore your knee injuries in an early stage. Please get them treated. Please identify these injuries at least for yourself so that you know the possible treatment options available. Again, I want to say the same thing. Every knee injury doesn't land up with knee surgery. 82% of the times we can treat them non-surgically. 20 to 30% of the times these would need knee ligament surgeries or knee meniscus surgeries there and there itself. If you have any knee injury related questions, please comment in my comment box and ask questions. I will try to answer them in my future videos. In order to hear to such more videos, please subscribe to my YouTube channel and click on the bell icon. Thank you.